My name is Dr. Kyoive Emmanuel, a senior resident doctor, Department of Hematology, Benue State University. This is the program organized is a kind of medical outreach in partnership with First Fertility Medicare Mall in Makurdi. Now, this is an outreach that we're covering as much as possible. It encompasses things like a full medical checkup. We're doing blood groups. We're doing packed cell volume. Now, by packed cell volume, I mean we are doing a blood check to know the amount of hemoglobin an individual has in their body. We're also carrying out genotype to enable people know their genotypes. As we all know, it helps to prevent conditions of inheritance of abnormalities like sickle cell anemia and the rest. We're also doing screening for human immunodeficiency virus, HIV. That's the retroviral screening test. We're doing hepatitis C screening. We're doing hepatitis B screening. Venereal disease research laboratory test, that's the test for syphilis, is also being carried out here, and several other tests. And we are also bringing youths, we're bringing people to come and donate so that it will help those that are in need of this blood. So this is a hydra-headed event actually. So many things are going on, and we're checking people's blood pressure. You know, most people go about without having an idea of what their blood pressure is. So I have my team of doctors on ground. We're interacting with the donors. We are those that may be reactive to, let's say, hepatitis, or those that their tests may detect abnormalities. We don't just allow them go. We have our records where it enables us to track them. We advise them, we tell them how to receive treatment. We counsel them appropriately on things to do and things not to do. For example, there are some people that have been reactive for hepatitis, hepatitis B, hepatitis C, or whatever. We counsel them, we don't let them go. We tell them appropriately where to go for medication, things to avoid, and things like that. So this event is a timely event, because health is wealth. There's nothing on this earth that you'll be able to do effectively if you are not healthy. So it helps to checkmate a lot of ills in our environment. Also, people are here. We are involving a lot of youths are going to be employed using this platform. So it will also help to curb the menace of unemployment in the society. So it's an all-encompassing event, and it's something we plan to go ahead with. It's not a one-off thing, because we are going to be doing it intermittently. If you go by the side there, you see so many things happening. People are asking questions. People want to know. People want to know what we mean by packed cell volume. People want to know what we mean by, okay, somebody's reactive for RVST. People want to know hepatitis B, what is it? We are counseling them appropriately. It is an outreach that we are doing so many things. We encourage, I really appreciate First Fertility, the entire management and staff of First Fertility. This venture is an expensive one. For them to put up such a thing is really capital intensive, and I really appreciate the entire management of First Fertility, headed by Dr. Wande. They have done a very good job, and I and my team, we are ready to partner with them as much as possible. Thank you very much.
Good day. My name is Stephen Obepa. I'm part of the medical team at the outreach organized by the First Fertility Group. We're currently at the First Fertility Mall here in Makurdi, and we're offering free medical services and health checks. We are checking people's health status, as well as offering them consultation services, running tests, and giving medical advice, as well as attending to their whole general welfare. We are all aware of the significance of checking your blood pressure. You know, it's known that blood pressure, a high blood pressure, would not necessarily manifest with symptoms. So you might have a high blood pressure and you wouldn't have the symptoms that are suggestive of such high blood pressure. So if you do not check your blood pressure, then there are chances that you could be having that high blood pressure and not be aware, and it predisposes you to so many health conditions which could be fatal if not captured quickly and promptly addressed. And in this society, there's a tradition of people not necessarily going to check their blood pressure. There are so many reasons why, but primarily I think it's a question of awareness. A lot of people are not aware of the significance of checking their blood pressure, and especially in a society whereby health services are not easily accessible and affordable, they tend to wait until illnesses start to manifest and then they go see the doctor. But we thank God for First Fertility for bringing this opportunity and creating such awareness and letting people know the importance of checking their blood pressure, because this is a disease that is known as a black man's disease, in the sense that the black people have a higher predisposition of having the disease, and we have lifestyle factors that contribute to this disease, such as our diets. We have high intake of salt, a sedentary lifestyle, so many things, so many compounding factors come together to cause this. So it is actually a high necessity for people to come around, get checked. It's free of charge, and be informed about their health status. We know that you need to be healthy for you to be fully functional and productive. So it's a wonderful initiative. We thank the First Fertility Group. We advise people to partner with them to come and avail themselves of the opportunity. The mall is such an expansive structure that boasts of so many facilities that can cater to a variety of health needs of individuals. So it's just right that you come, get checked, and just stay healthy. So thanks a lot.